I've realized there's been some confusing information about Social Security disability on the channel, both from me and in the comments. So I'm going to address that and try to clear things up today. I'm going to talk about dropping things, hand problems, carpal tunnel syndrome, and also obesity and drug addiction as disabilities. Hello, I'm John Foster. I'm a medical doctor who does Social Security disability exams. I've done a whole bunch of them, and I'm going to do a bunch more tomorrow. And as usual, everything I say reflects my own opinions based on my own experience and study, and not the opinions of the Social Security Administration or any other medical body. Now first, I'd like to talk about disability due to obesity and disability for alcoholism and drug addiction. And in the comments, I've seen some people saying that I am incorrect, that they know people who've gotten disability for obesity and they know people who've gotten disability for addiction. And in fact, they're not completely wrong. You used to be able to qualify for Social Security disability if you were severely obese. And you used to be able to qualify for Social Security disability if you had a severe addiction. But Social Security have changed their rules and regulations. And now, in February 2024, when I'm making this video, you cannot qualify for disability based on severe obesity alone. You can qualify based on adverse effects of obesity, such as arthritis in the hips, knees, or ankles, or severe diabetes or congestive heart failure. But severe obesity alone will no longer get your disability application approved. Likewise, you used to be able to qualify for disability based on a severe addiction, but that has been changed. Now, you cannot qualify based on addiction alone. You can qualify if the addiction has caused severe health problems, but only if those health problems would remain if you stopped drinking or drugging. And let me explain where this can be a problem. In the past year, I've seen 2 patients who were alcoholic who had cirrhosis of the liver and liver failure and applying for disability, but both of them continued to drink. Now, liver failure is a very severe illness that can make you sick as a dog or even kill you. But because these people are still drinking, Social Security will not grant them disability benefits. And the problem is, everyone who drinks and gets cirrhosis of the liver will improve if they stop drinking. But how much they improve is completely unpredictable. I've seen people improve a lot, people improve a medium amount, and people improve hardly at all. The only way to tell what's going to happen is for the person to stop drinking and wait and see what happens. So that puts people with addictions and serious medical problems due to those addictions in a bind. Here's a different example. I had a patient who was addicted to fentanyl, was injecting the fentanyl with a needle, and as a consequence got a severe stroke, rendering them completely unable to talk and also partially paralyzed on one side of their body. Now, they had stopped using fentanyl, and unfortunately these stroke effects were permanent, and that patient will qualify for Social Security disability. So understand that the rules have changed. Now, the second issue, where I may be at fault, I made a video which has turned out to be very popular called 6 Things That Will Not Qualify for Disability. And if you're finding this information helpful, I'd ask you to please subscribe and leave a like if you like the video. In that video, I stated that one of the things that will not qualify for disability is things that are normal. And I mentioned dropping things. Everybody has dropped things. Everybody with arms that move has dropped things. And in many cases, people tell me that they drop things, and I can't find anything wrong with them. But now I'm going to talk about things that cause problems with the hands and dropping things that are medical issues and will count towards disability. Social Security is very interested in the person's ability to use their hands, and they want the physician to describe their grip and ability to manipulate things. Grip is sheer power. Can you hold something tight? Manipulation is fine movements, for example, buttoning a shirt or tying shoes. And they want to know, is the grip strength normal and the ability to manipulate things normal? Now, when somebody has a problem with one or both hands, that problem falls into one of 2 categories. Either it's a neurological problem, a problem with the nerves that connect the hand and the brain itself, or it's an orthopedic problem, a problem with the bones and joints of the hand. I'm going to talk about neurological problems first. And first off, you can't use your hands normally if you can't feel them. That should be obvious. And there are 2 common causes for lack of feeling in the hands. The first and the most common cause I see is carpal tunnel syndrome. And I want to explain a little bit what that means. You have a nerve that runs down the front of your forearm and goes through a narrow space in the wrist here called the carpal tunnel. And then that nerve goes to the muscles here and gives you the strength of these muscles and the feeling of the thumb, index, middle, and 1/2 of the ring finger, the side towards the thumb. And in carpal tunnel syndrome, that nerve gets pinched in the wrist. That usually happens to middle-aged people, more commonly in females than males, although it definitely occurs in males. And it tends to cause symptoms at night. The person will say that when they wake up in the morning, their hand is numb, and if they shake it like this, the feeling comes back. And they often think the entire hand is numb. And it feels like the entire hand is numb. But if they actually touch each side of each finger, they'll find that they have normal sensation in the little finger and this half of the ring finger. The numbness, tingling, burning, and pain that people get with carpal tunnel syndrome can go up the arm as well as down into the hand. Carpal tunnel syndrome is graded one of 3 ways. Mild carpal tunnel syndrome, the person has hand numbness that comes and goes. Sometimes they can feel their hand just fine. Medium carpal tunnel syndrome, the person has numbness in the hand all the time. They never have normal feeling. And in severe carpal tunnel syndrome, these muscles become weak and paralyzed, and these muscles will shrink, and the person will lose the ability to pinch their thumb and little finger together tight. And when you can't grip tightly with your thumb, it's almost impossible to hold things normally. Another common cause I see for hand numbness is stroke, but in stroke it tends to affect one side of the body. In carpal tunnel, it's usually both hands, but usually one hand is worse than the other. So that's number one. Can you feel your hand normally? If your hand is numb, if you can't feel it, if you can't feel the thing that you're picking up or holding, you're going to have trouble using the hand. The next thing is loss of strength in the hand. And I've already said that with carpal tunnel syndrome, you get loss of strength here. In a stroke, you get loss of strength in the entire arm and hand, usually on one side. And strokes are very variable. You can have everything from a slight loss of strength to complete paralysis, where the patient cannot even twitch their fingers. And obviously, that's a severe disability. The next thing is coordination. Coordination is the ability to move carefully and precisely. Newborn infants have great grip strength. If you put your finger in the hand of a newborn infant, it will hold on so tightly that you can almost lift the baby up in the air. But they have no coordination. They can't type, they can't play the violin, they can't even hold a bottle when they're very small. Lack of coordination has many causes. It's fairly unusual, but I do see it a fair bit in stroke. Some people with stroke will have good strength and good feeling, but they just can't get their hand to move the way they want it to, and they'll have trouble using the hand and will drop things. The final neurological problem that can affect the hand is involuntary movements. When I go to pick something up, that's a voluntary movement. My brain is telling my hand what to do. The most common involuntary movement is tremor. The hand shakes and the person has no control over the shaking. And like most neurological problems, it can be a very fine tremor, which isn't really disabling, or it can be a very severe tremor, which really is disabling. There are other types of involuntary movements, but they're quite rare, so I'm not going to go into them in this video. Next, we come to orthopedic problems. And there are basically two types of orthopedic problems that cause significant hand disability. The first is pain. If you have severe pain in your hand, and that's usually due to arthritis in the joints, you're going to have a great deal of difficulty using the hand, moving the joints, and holding on to something tight. And I see this in patients with osteoarthritis. One of the common disabling types of osteoarthritis is called trapeziometacarpal arthritis, and that's an arthritis of this joint here at the base of the thumb. Most common in middle-aged women in their 60s, and it can really hurt and really make that joint tender. And when you try to hold something using your thumb, it can be so painful that you're unable to do so. The other problem is joint instability. That's when joints move in ways that they're not designed to move. For example, our fingers bend, but they don't bend side to side normally. In some conditions, like rheumatoid arthritis, the joints of the finger lose their stability and they'll move in all sorts of abnormal ways. and it's hard to hold on to things, and it's hard to do things like buttoning a button or tying shoes if your fingers are wibbling and wobbling all over the place instead of moving the way you want them to. Now, if somebody complains of dropping things and their sensation in the hand is normal, the strength is normal, they have normal coordination, no involuntary movements or tremor, no signs of problems with joints such as tender or swollen joints or joints that are unstable, and they tell me that they drop things, they're probably a normal person with a normal tendency to drop things from time to time. But it's very important to test the strength, sensation, coordination, look for abnormal involuntary movements, and check the joints of the hand before saying that somebody is normal. Well, I hope this has been helpful, and as always, remember, if it happens, it's possible.